I'm Matt Willis, Public Health Officer for Marin County with a COVID-19 update for February 10th. Today, Javier Becerra, Director of U.S. Health and Human Services, announced the federal COVID-19 state of emergency will end May 11th, 2023, or about 3 months from now. I'm going to answer some questions about what this means for us in Marin and how it relates to local and state emergency declarations. First, remember that we as Marin residents have been operating under 3 main layers of government throughout our pandemic response: the county, state, and federal level. With emergency declarations, each is independent, has its own start and end date. We've tied the end of our local emergency to the governor's, so the Marin and California COVID-19 pandemic emergencies will end on the same day, at the end of this month, on February 28th, 2023. That's just shy of 3 years after they were put in place. The federal emergency will end in 3 months on May 11th, as announced by HHS today. The local declaration was mostly administrative and gave us flexibility in our workforce, the ability to seek and use mutual aid, and to obtain financial reimbursement from federal agencies like FEMA. In fact, the federal changes are the most important to our residents because they impact access to COVID testing, treatment, and vaccinations. Stepping back, the pandemic response led to a kind of parallel health system, where testing, treatment, and vaccines were free and offered equally to everyone through government funding. Our work locally was to ensure that that led to actual equity and access to life-saving tools. Most of what we offered as a local health department to the general public was through federal funding passed through the state, and much of that COVID-dedicated federal funding is going away. The best way to think about the change is to realize that come summer, the feds see COVID as just another infectious disease. Don't expect to see dedicated COVID testing sites or vaccine clinics outside of routine healthcare settings. It's encouraging to note that there are federal stockpiles of critical tools, including rapid tests, bivalent vaccines, and treatments. So support will ramp down over time. The timing of when we, as residents, will need to start paying or relying on the usual healthcare economy will be based on supply. Paxlovid, for example, should remain free of charge until the fall of 2023 at least, because the government purchased so much from Pfizer. After that, though, Paxlovid will be privatized, and the price you may pay will be based on your insurance provider. For rapid antigen tests, I recommend you order your 8 free tests to be mailed to you from the federal government before May 11th. Vaccines will be covered for anyone who's insured, like flu shots, ongoing. So as COVID response moves back into the normal healthcare economy, it's a bit scary from a public health standpoint, because privatized and commercialized healthcare is not often friendly to marginalized communities. Health systems aren't exactly looking for more problems to take on, even for their insured patients, and people who are uninsured are usually left out. So in Marin, public health will be focusing our ongoing response on those who might otherwise fall through the cracks or don't have access to health care, who are most vulnerable. For example, for vaccinations, we'll maintain a core team focusing on long-term care facility residents, the uninsured, and homeless residents, while the general public will be looking to their healthcare providers and pharmacies for COVID-19 vaccinations, the way they do any other vaccine. With regards to the end of the pandemic, we can't expect a moment, like V-Day in World War II, where we can all celebrate and it's finally over. Instead, we see more of what we're already experiencing, a more gradual process. As the burden and impact of the virus diminishes, we'll see a stepwise removal of COVID-specific infrastructure. Eventually, we'll reach a new set point, where it's another virus we see as a natural part of our environment, and we'll use tools like testing, treatment, vaccines, and masks as needed, and not necessarily as emergency measures, but as routine. Along that path, one of the most important signals of a post-pandemic era is the end of these states of emergency. At the same time, it's important to distinguish the human administrative decision to end the state of emergency from the natural activity of the virus itself. While the crisis phase is likely over, it's important we know COVID is still active and may have some curveballs for us in 2023. So we'll be staying on top of this as a local health department and communicating with you regularly, trusting that we can stay responsive together to protect one another as we have over the past 3 years. Thank you for doing your part.